Hello friends, welcome back to Complete Medical Coding. Today let's learn an important topic which is Z codes. All you need to know about Z codes. How to use Z codes, where to use, what are the sequencing, can we use Z codes as primary, secondary, how it is. Okay, so let's learn all those guidelines and few examples from the Z codes. So friends, if you are new to the channel, please subscribe and let's move to the video. Let's move to the slides one by one. What are Z codes? So this is the range of Z codes which starts from Z00 to Z99. Okay. Z codes are diagnosis codes used for situations where patient doesn't have a known disorder. So, where are we using Z codes or what are those Z codes? Z codes are the diagnosis codes which are used for situations where patient doesn't have a confirmed diagnosis or the patient doesn't have a known disorder. We cannot say confirmed diagnosis. Patient doesn't have a known disorder. Okay. This is just to check whether the patient is having, like a query, if the patient is having this disease or not. Z codes are status codes used for documenting reasons for medical encounters that aren't illnesses or injuries. Same. If there is no present injuries or illness, no present injuries or no present illness. So for documenting the reasons for that encounter, we are using Z codes. Like as a history, we are using Z codes. So this could arise in two ways. First one, when a person who may or may not be sick encounters health services for some specific purpose, such as to receive limited care or service for a current condition or to discuss a problem which is in itself not a disease or injury. So that is the first case. Okay. It means when a person who is not sick, not at all sick, but he wants to check his health, current health condition, health status. So for that encounter, so for those cases, those encounters, we will mark it as Z. Okay. Like for example, Z00, which represents a general health checkup of a patient. But the patient doesn't have any symptoms, current symptoms. Currently, the patient doesn't have any symptoms or illnesses or injuries. Now, second one, when some circumstance or problem is present which influences the patient's health status but is not in itself a current illness or injury. So again, here some circumstances or some certain conditions which may reflect the patient's health status, but it is not a current illness. So in that case also, we will mark it as a Z code. Okay. Now, when to use Z codes? Z codes are used to describe social problems, conditions, and risk factors that influence a patient's health status. Okay. We will discuss in detail. Z codes are usually 3 to 6 characters long. Only up to 6 characters. There won't be any 7th character in Z code usually. Okay. They can be billed as first listed codes in specific situations like aftercare and administrative examinations or used as secondary codes. So Z codes can be used as first listed codes in certain conditions and also they can be used as a secondary code. Okay. Now these are some common Z codes for therapists. Here are some common Z codes you may use in your practice for therapist. These are some examples. Not examples, some direct Z codes. Z00.4, which represents general psychiatric examination not elsewhere classified. Z03.2, observation for suspected mental and behavioral disorders. Z04.6, general psychiatric examination requested by authority. Z09.3, follow-up examination after psychotherapy. Z13.3, special screening examination for mental and behavioral disorders. Z13.4 special screening examination for certain developmental disorders in childhood. Z50.4 psychotherapy not elsewhere classified. Z54.3 convalescence following psychotherapy. Z71.1 person with feared complaint in whom no diagnosis is made. Z71.9 counseling unspecified. Z81.8 family history of other mental and behavioral disorders. Z91.4 personal history of psychological trauma not elsewhere classified. So these are just few examples that I'm giving you, like a category, okay, where you can find out, like you can find the same in your ICD code book as well. Now, categories of Z codes. These are the categories of Z codes that you will find in ICD-10 data 2025. Almost it's similar as in the previous version also. I mean in the previous years also. Okay. So these are the ranges. I'm just reading it out for you. Z00 to Z13. In this range, this category represents persons encountering health services for examination, general health examination. This is what you need to code. Z00 is very important code where you will be frequently getting while, like, when you will go for job, you will frequently definitely get these Z codes using Z codes. Okay. Then Z14 to 15. Z14 to Z15. Genetic carrier and genetic susceptibility to disease. Z16. Resistance to antimicrobial drugs. Z17. Estrogen and other hormones and factors receptor status. Z18. Retained foreign body fragments. Z19. Hormone sensitivity malignancy status. Z20 to Z29. Persons with potential health hazards related to communicable diseases. Z30 to Z39. Persons encountering health services in circumstances related to reproduction. So this one mostly we will use during pregnancy period. Okay. Z40 to Z53. Encounters for other specific health care. Z55 to Z65. Persons with potential health hazards related to socio-economic and psychosocial circumstances. Z66. Do not resuscitate status. Z67. Blood type. Z68. BMI. Body mass index. Z69 to Z76. Persons encountering health services in other circumstances. Z77 to Z99. Persons with potential health hazards related to family and personal history and certain conditions influencing health status. These are certain categories just for you to understand what is all about in Z codes. Now these are some other categories of Z codes. Z55 problems related to education and literacy. Z56 problems related to employment and unemployment. Z57 occupational exposure to risk factors. Z59 problems related to housing and economic circumstances. Z60 problems related to social environment. Z62 problems related to upbringing. Z63 other problems related to primary support group including family circumstances. Z64 problems related to certain psychosocial circumstances, and Z65 problems related to other psychosocial circumstances. So these are I have just mentioned all these codes in order to make you understand that we are using or we will be using Z codes in future, especially when you will go to work, when you will start your career. Okay, as a medical coder, you will definitely encounter Z codes in every day. You will get at least like 5 or 10 encounters with Z codes. Okay, so that's why I had just mentioned all these categories. All this you will be getting in ICD code book. Okay, so these are the categories. Now let's discuss some questions, some important like general but important questions and guidelines along with the questions. Okay, so friends, these are some important questionnaire, some important like examples you may encounter, you will be encountering in the future. In your exam also you will get few questions related to Z codes, but it will be like combination codes, combined codes along with other ICD questions. Anyway, here I am giving you some time, okay, to do this questions. You can do this as a practice. These 7 questions. Do it as a practice. Do it right now if you are ready to do. Okay. This may take approximately 5 minutes for you to answer these questions because it's simple, but you need to know that sequencing, or you need to know that guideline. That's why I had mentioned these 7 questions here. So you can pause this video. Okay, if you want, you can pause this video. Then take 5 minutes. Go through these questions. Take 5 minutes and do the answer. Then after 5 minutes, okay, I will be explaining you. After finishing your answers, I will be explaining you each and every questions with the answers. So you can start doing it now. While you do it, while you are doing these questions, I'll just read out it for you. These questions for you. Okay. First one. You can use Z codes as primary diagnosis codes. True or false? Second one. You should use Z codes only to represent history of diagnosis. True or false? Third one. When the OB/GYN doesn't get to the patient in time to deliver the baby, she delivers in the emergency department, but does deliver the placenta. The code is 59414, delivery of placenta, separate procedure. You should report dash because the emergency department doctor will report OAT, which is encounter for full term uncomplicated delivery, assuming there are no other issues complicating the delivery. Fourth question. When you are doing a hepatitis screening test for a non-pregnant OB/GYN patient, you should report dash in the absence of any symptoms. Fifth one. A patient comes in for enteritis, but the OB/GYN doesn't order an NST. Instead, he documents that the patient's enteritis was incidental to pregnancy. In that case, you should report K52.9, which is non-infective gastroenteritis and colitis unspecified, and dash. Sixth one, if a pregnant patient has been exposed to parvo, but you don't have the definitive test results back yet, you should use O09.89, which is supervision of other high-risk pregnancies, with a 6th digit based on trimester 1, 2, or 3, and dash for the diagnosis codes. And last, 7th question. For a patient who has had a tubal ligation but has not made an attempt to have it reversed, the only diagnosis would be dash. So these are the 7 questions. I had read it out in hardly 2 minutes, but you can take 5 minutes maximum. At most 5 minutes only you should take for answering this type of questions. Okay. Once you have done answering, you can check out my answers. Anyway, I'm going with answers one by one. What was the first question? You can use Z codes as primary diagnosis codes. True or false? Yes, it is true. You can use Z codes as the primary codes as well as secondary codes, but it's a case-to-case basis. Few coders believe that we can use only Z codes as secondary codes, but it is a misconception. That is false. Okay, you can use Z codes as both primary as well as secondary. Mostly secondary, but for primary it is case-to-case basis. Okay, so it is true. Now second question. You should use Z codes only to represent history of diagnosis. Is it true or false? No, that is false. Z codes are your keys to documenting chronic conditions or underlying physical or social circumstances that can affect a patient's current health status or treatment. This is what I had already mentioned in the second slide, the risk factors the certain factors where you used to like where to put Z code. Okay, so not only to present the history of diagnosis, but also to mention the patient's like underlying condition, underlying physical or social circumstances that affect the patient's current health condition. In that case, you will use Z code. I'm sorry. Like for example, when a person who is not sick, okay, when a person who is not sick encounters health services for some specific purpose, like for example, the patient who is acting as a donor of an organ, in that case, we will mark a Z code. Or else, when a person with a known disease or injury, whether it is current or resolving, encounters a healthcare system for some specific treatment of that disease, which is related to that disease. In that case, you can use a Z code. Then, for newborns, to indicate birth status, in that case, you will use Z codes. Now, when a circumstance or problem influences the patient's health, but it is not itself a current illness or injury. So, in all these cases, you will use Z codes. Now, third question. When the OB-GYN doesn't get to the patient in time to deliver the baby, she delivers in the emergency department, okay? But does deliver the placenta. Delivery of placenta 59414 code, which is a separate procedure. You should report which code. For the OB-GYN, which code you should report, okay? Because the emergency department doctor will report OAT. So here the delivery occurred in the emergency department. So that doctor, emergency department doctor, will report OAT as the code for full-term uncomplicated delivery. But for the OB-GYN, which code you will use? You have to use Z39.0. Encounter for care and examination of mother immediately after delivery, because after delivery there is postpartum treatment and care, postpartum care for the mother. So for that, OB-GYN is the one who will be treating, right? So for that, you need to use the code Z39.0. All right. Now, fourth one. When you are doing a hepatitis screening test for a non-pregnant OB-GYN patient, you should report dash in the absence of any symptoms. So which code you will use here when you are doing a hepatitis screening test? So here you have to use the code Z11.59, encounter for screening for other viral diseases. Since this is a non-pregnant OB-GYN patient, this patient is not pregnant, but it's an OB-GYN patient. So in that case, Z code, this is the C code that you need to use, Z11.59, because this is for screening of other viral disease. Hepatitis is a viral disease. Okay. Now, fifth question. A patient comes in for enteritis, but the OB-GYN doesn't order an NST. Instead, he documents that the patient's enteritis was incidental to pregnancy. In that case, you should report K52.9. What is K52.9? Non-infective gastroenteritis and colitis unspecified. And which Z code? Which code you should use here? Because the patient has come in for the enteritis, but the OB doesn't order any test for enteritis. Okay, but it is incidental. This condition is incidental to pregnancy. So in that case, you have to code K52.9 and Z33.1. Z33.1 is pregnant state incidental. So this is pregnant state. You have to code, but the patient came in for the enteritis procedure. So that will be the primary K52.9. Okay, so K52.9 and Z33.1, like that you need to code here. Now, sixth question. If a pregnant patient has been exposed to parvo it's a viral condition, okay, parvovirus, but you don't have the definitive test results back yet, you should use O code O09.89 as a primary diagnosis, okay, supervision of other high-risk pregnancies with a sixth digit based on the trimester, which trimester it is, 1, 2 or 3, and dash for the diagnosis codes. And which Z code we will use here? If the pregnant patient is exposed to parvo, whenever there is a pregnant patient, whenever you are coding any pregnancy, again and again I am repeating you have to always mark O code as a primary. So here O09.89 for the supervision of high risk pregnancies, because parvo is a viral condition. 891, 892, 893, whatever it is, depending on the trimester. And then with Z code. Here you have to code for that parvovirus, which is Z20.828. Contact with unsuspected exposure to other viral communicable disease. This is a viral communicable disease, parvo disease. So Z20.828 you have to mark it along with O09.89, which is the primary. Okay, and Z code should be secondary here. Now 7th question. For a patient who has had a tubal ligation but has not made an attempt to have it reversed, the only diagnosis would be tubal ligation status. What will be the diagnosis here? So here in such cases, if there is only one code, of course, that Z code will be primary, right? Z98.51. Because here the patient had a tubal ligation, but it is not reversed. So here you have to use the code only for the tubal ligation status, Z98.51. Only this one you need to code here. Okay. So friends, hope you like this video, because these are few important guidelines, few important questions that I had taken from different various places, where you will get to know how you need to code Z code, or how is the sequencing and everything. And in the coming mock questions, in the upcoming episodes, you will be getting questions related to such type of Z codes. So friends, hope you like this video. If you have any queries, please mark it in the comments. And thank you so much for watching. Thank you so much for your support. If you are new to this channel, please subscribe. And please like and share my videos, and share it among your friends, especially for those who are preparing for the examinations. Okay. And thank you so much. Stay tuned for more videos. Thank you, friends. Bye. See you.